Hi, I'm Mike Dilk and you're listening to the Relax Back UK show, the show that explores all kinds of health topics relevant to you, your family and your friends. Each week I talk to expert guests from a range of backgrounds to inform and entertain you. So please do join the Relax Back UK family and stay tuned.
Hi, and thank you for joining me with this episode of the Relax Back UK show. The UK's government is very keen to boost growth and long-term artificial intelligence investment, and the use of AI to drive efficiency in publicly funded enterprises is very much part of this. This episode looks at the NHS, particularly pathology and the growing demands that on pathology services and how technology and AI can help.
The number of tests that need to be carried out has been going up year on year. Part of that is due to demographics. People get older, there's more concern and more tests that you have to do. Part of it is that there are more ways of finding out people's condition and training, treatment. So therefore there's tests around that, particularly around as precision medicine agenda coming in. There needs to be tests to make sure you match the right medicines to the right patients.
My first guest is Dr. Hugh Cormican. He's CEO of Surdan, which is a medical technology company. Then another area that could benefit from greater use of technology and AI, that's social care.
Increasingly, we can see a point in the future where things like vital signs, heart rate, blood pressure, sleep patterns will all be able to be combined with that STEPS data, again, to get that more and more accurate picture of what's going on with you inside, which might indicate the likelihood of having a fall.
My guest to discuss social care and technology in AI is Stephen Gates from Taking Care. So please do stay tuned for a great show. Thank you.
This show is cool!
Before talking to Dr. Hugh Cormican about pathology and how AI and technology can make pathology done a lot more efficiently within the NHS, I thought I'd better ask him a more basic question of what exactly is pathology anyway?
Well, pathology is the study of disease. And typically, though, pathology labs extend beyond just looking to diagnose disease. They're also involved in the treatment of patients and particularly of trying to identify how the treatment of patients can be improved. Those pathology labs are critical and the main engine of any healthcare system. 95% of all the clinical pathways in healthcare go through the pathology lab. And It's quite often, unfortunately, overlooked. And really, the pathology people are really the unsung heroes of the healthcare system. They're day and daily and 365 days a year, 24/7, are doing testing and turning around results to help with the healthcare of people who are looking for diagnosis or people undergoing treatment to help them to get the best result outcome.
Okay, so my layman's view of a pathologist might not have been quite correct. I initially, my thought was, okay, so what they do is they look at bits that have been cut off patients to see what they're suffering from. So the classic thing might be a tumour. And the bits they're looking at, they don't answer back. They don't need attention in the middle of the night. It's a 9-to-5 job with easy patients because they don't answer back. Easy life, 9-to-5, and a doctor's pay. It sounds like I might be a bit wrong here.
Yes, I think you are. You're glossing over the looking at tissue samples is about histopathology is only about 10% of the work that they will typically do. So we would have labs that, for example, they have to provide blood transfusion service. So, maybe a patient coming in from a road traffic accident needs a transfusion. They have to match the blood, get the blood, and make sure they have the right blood for the patient. So they have to be available all through 24/7. They also will do, so if you go to your GP and you're unsure, you're not feeling well, you're feeling tired, they can conduct a battery of tests that will go to the pathology lab, looking at your biochemistry, your hematology, looking for signs of infection. All of that is done in the pathology lab. And those, and particularly in terms of maybe patients maybe going into sepsis or patients who have issues with blood conditions approaching blood cancers, those things can happen very quickly. So they have to be available 24/7 to be able to do that. So, the pathology lab, has to run service 24/7. And the labs that we support around the world, they run 24/7 for these reasons.
Right. Okay. And the impression I'm getting is that there is actually a shortage of pathologists right now. Is that more acute with pathologists, or is that doctors in general?
Well, I think there's well known that there are tensions and pressures on the healthcare system, but because the pathology labs are critical to the overall function and running of a healthcare system, it's particularly acute there. The problems is that the number of tests that need to be carried out has been going up year on year. Part of that is due to demographics. People get older, there's more concern or more tests that you have to do. Part of it is that there are more ways of finding out people's condition and training, treatment. So therefore, there's tests around that, particularly around as precision medicine agenda coming in. There needs to be tests to make sure you match the right medicines to the right patients. All of that puts a lot of pressure on the lab and increasing work in the lab. But unfortunately, staffing across the lab has not really picked up on that. And a lot of the labs are working on a lot of legacy IT systems, are not able to do the work that they need to do. They're not given the tools that they need. They're not given the time and space that they need. And they're constantly under pressure because of this under-resource. That is particularly acute in the labs. And too often that pathology part of that healthcare network is overlooked, and it doesn't get the full attention it really needs.
You're kind of describing a perfect storm, aren't you? Lack of tools, lack of people, and lack of understanding.
Yeah, and there's a catch-22 there because they're under pressure to do the business as usual in the test. They're not able to look ahead to see how they can bring in a lot of the new innovations that are coming through and bring in improvements to the systems and the IT systems that will help them with their work, because they haven't got the time to devote for that. So they're caught in a pinch there, and they're caught, and that really is something that we feel that needs attention, and the government needs to step in and help the NHS and help, bring that change about so that people can take the time and improve that overall process and structure, which will have big benefits across the whole healthcare system.
Okay, well, let's think about some of the improvements, some of the different changes in structure, etc., that you mentioned. Now, you're a medical technology guy, so obviously you're going to be talking about these things, and there are some fantastic advancements that have come along recently. A lot of these are in the news. AI, everyone's talking about AI and how that will help a lot of things. But what are the potential solutions that are going on? And probably not just AI, but that could well be one of them. If you were in charge of everything, Hugh, how would you sort it all out?
Well, I think that there's a lot of innovation coming through on imaging, which in pathology imaging can improve the speed and the processes around diagnosis. AI is a big part of that, and being able to use AI and support the pathologist and provide major productivity gains, and connecting the pathologists directly with patients can be a big leverage as well, because where there's treatment of a patient, the labs would be the main sort of point, but usually they have to mediate that going through maybe their GP or through a clinician or through a consultant. If they connect using digital health technology to the patient, there's a lot more efficiency in the system, and they can turn that around. And particularly patients that are under treatment, if they're obviously within sort of the reasonable guardrails, that they don't need to have the intervention of a GP or consultant, and the labs can manage those patients very effectively if they have the right digital health tools. So there's innovation in digital health for the management.
Let me just butt in there, because you
Sure.
Connect to the patient using digital health. Can you translate that a little bit? If I'm the patient and I've just had a bit taken out of a potential tumor or something, what does that actually mean? Connecting to me, the patient, via digital health. What actually happened?
Well, more typically, for example, there'll be patients that would be undergoing treatment for coagulation therapy, making sure their medicine's titrated to make sure that their blood is kept to the right level. It's not likely to clot, or it's not too thin. And that involves getting testing and getting feedback from the testing and feedback from the labs. And using a digital health app, they can get that feedback a lot more effectively without a lot of intervention, without phone calls and calling in. And that can be a saving to the healthcare system and make it life easier for the patient. So the examples like that,
we're just talking making communication easier.
Yes.
So you're not sitting around at home waiting for a phone call. You can actually dial in and find out your information.
So you get a notification on an app to say that the results are here. Here's what you need to do now, and we need you to come in for another test, maybe, or other work. So you can speed up that sort of immediate that time, and that speeds and takes a lot of the time out of the healthcare system. It makes it much more efficient. So having those digital health tools, having the AI tools to help with the to be able to provide support for annotation of reports, provide support for looking at understanding the reports and looking at the sort of the history of the patients, to sort of look for trends in the history and identify those quicker, makes it easier for the pathology department to be able to respond quicker. So and then, like I say, there's new imaging technology which is coming out, which will make it a much more effective to image the tissue in the case we are looking at tissue. Rather than have to go through long, lengthy processes in the lab, you can get initial feedback very quickly on the tissue, whether it's abnormal or not, or whether it's normal, and that can be a great saving to the patient in terms of reassurance that they know that the patient, it can take away the pressure and understand exactly where they are. Too often now there's long waits for patients, and too often that they have to wait for too long to get the information, and that obviously causes unnecessary distress and concern waiting for those results.
Yeah, and actually, if you can start the treatment sooner, certainly, well, in the case of everything probably, but certainly in cancer, the results are likely to be better.
Exactly. And the sooner you can treat and start to treat, you've got much better outcomes, which is better for the healthcare system as overall, and obviously much better for the patient.
Let's just home in on the AI and use of scanning technology. So I keep coming back to tumours. I suppose that's something because I understand. If the AI is looking at a tumour, a slice of a tumour, and trying to interpret if it is cancer, what sort of cancer, all that kind of thing. This has been in the news a lot recently. Is this now so advanced that it is as good as a human, or even better than a human if that human's been working for the last 15 hours and hasn't had a break?
Well, to be honest, most of the evidence so far suggests that it is as good as a human, but the AI technology offers a great opportunity because it means that there can be a sort of review, a second review. So you can have a pathologist review the tissue and make a diagnosis. And you can have an AI algorithm also take a review. And obviously, if they're in agreement, then you have a very high confidence that the treatment and the diagnosis is right. Or if there's a discordance or a disagreement, then you can consult to a third person. That provides a lot of efficiency, and it also can help. There are certain things computers are better at, like counting cells and measuring sort of amounts of markers or intensity of measurements. That's so much easier for a computer to do than a human person. They're much better at it. Let them do the hard work.
Yeah, so these technologies are wonderful, but I suppose even if they do come up with a better answer or an answer that is correct more often than from a person, what really matters is if people trust it. So do doctors trust these things? And I suppose even more importantly, do patients trust these things?
Well, I think that patients will certainly be more confident if there's a doctor there. So we always see AI as supporting the clinicians, the pathologists with their result, because we think that that's important, communication that pathologist. Too often people think a pathology lab as the lab, and increasingly we should be thinking about the people in the lab who are providing that diagnosis. And I think in the future they'll want that confidence from that person. But the more we can provide information and insight for the pathologists, the more confidence they can have, which actually is something that pathologists sometimes worry about, if they have to rush a diagnosis, sometimes that they don't put their full attention on it. And having an AI supervision or overview on it would certainly give them a lot of confidence that they've made the right decision, and also can provide, a lot of the sort of background information to make it, more compelling in terms of their argument and diagnosis. So, I think the AI is going to be important sort of a help and support for the pathology labs. And I think that's where a lot of people probably in healthcare would prefer to see it initially. Longer term, there's opportunities for other things, but I do think that really it's helping to provide the productivity gains for the pathologists and allow them to do their work faster and quicker and better is really what we want those tools for, not to replace the pathologist. And that's certainly something that I would be very keen about. I would like to know that there's somebody, if I have a tumor getting analyzed, that there's a person I can go talk to at some stage who knows.
Yeah, no, I would as well, for sure. Yeah. Let me ask.
But one of the problems we do have though is, it's difficult to add that technology, that AI technology. I mean, there's no point in putting a new mobile app on a landline. The backbone of the infrastructure in the labs needs to be upgraded to allow that to work. And that's where there's a big shortage at the moment. I mean, this new technology is in development. It's very good, but there's no medium to actually roll that out in the labs. And a lot of the labs aren't able to take advantage of that yet because there isn't infrastructure to allow them to do that.
That's very much actually what I wanted to ask you next, because I'm quite sure the fax machine is alive and well in a lot of NHS hospitals. And this is old technology. Maybe it works absolutely fine or did, but you can't build new stuff on top of the fax machine. It sounds, if you're nodding your head, it kind of seems that you've come across these sort of problems a lot.
Yeah, and more importantly, it's the pathologists and the people working in the lab, the biomedical scientists are so busy. They haven't time to learn how the new technology should work, and they haven't time to help get the new technology into their lab. They're caught in a sort of, a rock and a hard place between, having to do the work day to day to get that done and not able to look to the future and bring that new technology in. And that technology is very important, and the infrastructure behind it needs to be there to allow the labs to work effectively across, to deliver the effective use and get the productivity that we would really like to have. And if we have that, then it provides a great benefit to the whole healthcare system throughout the whole healthcare.
Yeah. Let me ask something else. You mentioned that there are many more tests just because, technology, medical science has advanced. So doctors test for many more things. We're all getting a bit older, so people are more ill. So there's this massive increase in laboratory testing that has to be done. Now, my image of laboratory testing is each test is done by one person kind of with a vial of blood and a pipette, and they have to drop something in or what have you, which that's my sort of my layman's view of it. Can all that kind of thing be done by robots and done very scaled up? And is it at the moment, or should it be more? What's the situation?
Yeah, no, a lot of the labs, when they're on their clinical pathology side, will have sort of little robotic tracks where samples will go down the robotic track. A robot will basically pick up the sample and put it in an analyzer and get the result. So a lot of that can be done in automation, and there is automation behind that, and that is available in a lot of the labs currently. But it doesn't connect well to the overall system in terms of where those containers come from, how they're labeled, how they get in there. And also, in you talk about tumor, it's a lot more manual process at the moment in terms of the histopathology, where you're looking at tissues and tissue samples. And that's particularly an area where there can be a lot of productivity gains by future imaging technologies and the digital technology and then the AI. But certainly a lot of the bulk tests in biochemistry, hematology is done with robotic systems, and that works reasonably well. But there are issues in terms of then downstream of that and upstream of that, how they were collected and how then their result and analysed, that there could be major productivity improvements.
Goodness me! Just from this short chat, I think I can understand some of the issues and some of the problems and some of the improvements that need to be made. So kind of with all that in mind, would you suggest to a young person who's thinking of becoming a doctor and wondering what specialism to take, yeah, go ahead and try pathology. It's wonderful. Because actually, at the moment, it sounds like some aspects are slightly less than wonderful.
The pathology is sometimes known as a doctor's doctor. I mean, they are the reference that doctors go to get their results. It's a very important science and very critical science. And if you really want to make a difference, for people's healthcare, I mean, being based in pathology is a great opportunity for that. And certainly, I would recommend people to be a pathologist. Probably I might have taken a different career path if I had known more about pathology when I was younger. I didn't get to know that, and so I didn't get into that area. But I would love to have been.
Okay. And what about all the opportunities for technical opportunities? Because a lot of the things we've been talking about, you can make a tremendous amount of advance with, and you don't have to be a doctor. You need to be a technical whiz. That sounds like the tremendous opportunities in that area at the moment.
Yeah, so in our company we have people who worked in labs, who worked on the bench, but we also have a lot of people in software and people in AI, looking at the data, looking at understanding, how that data can be used then to make predictions and also how to make that data more accessible and useful. So certainly, I mean, there's people in software, people in IT. People in photonics, in terms of the imaging technology to understand how that imaging can be improved. So there's a lot of areas where that technology can bring real life benefits to helping patients, making their well-being better and speeding up their diagnosis and consequently making their health better. And it's better for the healthcare system as a whole if you can get people and treat them earlier. And you can then quite often avoid them becoming acutely ill, which can be expensive to the healthcare system, by helping support and monitor them and understanding of their conditions.
Okay. And if people would like to, either from a layman's point of view or from a medic's point of view, find out a little bit more about some of the things we've been chatting about, can you suggest a good resource?
Yeah, well, the Royal College of Pathologists and the RCP, if you look at their website, or the Institute of Biomedical Scientists, they're the people who work the lab. They're the unsung heroes that we're talking about in terms of the work that they do in the lab. They're represented by, if you go to their website, they have information there about their careers and opportunities and about their work. And even if you go to the NHS, it has some websites explaining about where the role of pathology is. But particularly if you go to the Royal College and the Institute of Biomedical Scientists, that they would be a good source.
Excellent. Hugh, thank you very much indeed for taking the time to chat. This is really interesting and important stuff.
Thank you, Mike. Appreciate the time.
Before the next section on social care and technology, I just want to remind you of my book, which is based on the interviews with experts on the Relax Back UK show. It's called Cut the Crap, Ask the Questions That Matter About Your Health, and is a great read for anyone interested in health of any sort. Now, Steve Gates is from Taking Care, a social care company, and I started by asking him if the use of tech and AI in the social care world is more sophisticated than a button round your neck that you can press if you need help.
Increasingly, it is massively more sophisticated than that. So you are right. That is part of what we do as a company. However, increasingly, we are talking about devices that are very discreet. You would not know that they were any different from the Apple Watch or the Fitbit that you and I might be wearing. And also increasingly, we are using the data that is produced by these devices to try and get ahead of the curve and to try and prevent a fall from occurring in the first place. I think we can all understand that for an older individual, a fall is a really serious health event.
Yeah, I mean, often that's the start when everything starts to go downhill, isn't it? You go to hospital, you don't move much, and it's just a vicious circle.
You are absolutely right. The NHS calls it the cycle of frailty, which is exactly that. That after the first fall, you tend to move around slightly less, you lose a bit more muscle mass, you lose your sense of balance, you then fall again, and each time your injury becomes more severe. So you've absolutely explained why trying to avoid falls or prevent falls using technology is an increasingly big part of what we can offer.
Okay, so how's this little thing around someone's wrist going to stop them falling over in the first place?
So I think there are two things around someone's wrist. Let's take something as simple as a Fitbit. We can now extract that data from your Fitbit that you're wearing. We can run it through an algorithm, and we can predict your likelihood of falling anywhere from a 0, which is no increased risk of falling, all the way up to a level 3 is what we call it, which means that you are within 10 days of having a fall. So that allows us then to call out to you to make sure we understand with you what's led to this likelihood of the fall occurring.
Right, so what data is this? What data is it that you're sort of noting at this stage?
So it's the classic data that you would expect. It's things like steps. So one of the biggest indicators of a fall coming up is that your step count reduces dramatically. And that suggests that you're sitting around more, you're sedentary more. Therefore, again, you're losing a bit of muscle mass, you're losing that sense of balance. So steps are the classic indicator, but increasingly we can see a point in the future where things like vital signs, heart rate, blood pressure, sleep patterns will all be able to be combined with that steps data, again, to get that more and more accurate picture of what's going on with you inside, which might indicate the likelihood of having a fall. So, right. So that's one of the ways that we can extract that sort of data and use it for a way that's really beneficial.
So is that happening at the moment, or is it just looking at steps?
At the moment, it's steps because that's the biggest indicator. But we are looking increasingly. So you talked about the technology. Increasingly, the technology you wear on your wrist or around your neck has automatic fall detection in it. And what that does at the moment is it detects a fall from height. However, in the future, we're expecting to be able to combine that with heart rate data and blood pressure to go, right, this is absolutely a fall. This is a real fall, not this is someone who's just had to sit down quickly in the sofa and bang their device. So this is where we're trying to use some pretty traditional devices, but bring in some more data and some more insight.
Okay. Can it detect things that might be a little more sophisticated? So, for instance, I don't know, if someone starts going to the loo a lot, can you detect that, when they're moving around in their home? Because that might be useful data.
No, absolutely. That type of data is there and available. So we have an offering called Safe Home Alert, which involves motion sensors in your house, so it can detect how you're moving around your house. We don't do it, but it is possible to put a motion sensor on the toilet, which therefore identifies if you're likely to have a urinary tract infection, a UTI, which again is a serious health issue for an older person. So you're right, in a very discreet way, and I think privacy and independence are absolutely crucial here, but in a very discreet way, it is possible to collect the data, which can then be provided to the family, as an example, to go, you might just want to have a word with mum or dad. It looks like they are increasingly not moving out of their front room between the hours of 10 and 4 o'clock in the way we would hope they were moving around the house. Now might be the chance to have that conversation just to make sure that they're feeling up to it, that maybe they've got some new medication or something that's making them feel more drowsy. So again, there's a whole series of things that we can learn based on the data that can be collected.
Sure. So actually, I think you partially answered my next question, which was going to be what happens when it detects something odd, so there's a call to a relative. But can it be set up? Is it set up such that if a fall is detected, and then in the future when the heart rate is low, it just goes straight to the ambulance service?
I think that's probably something that we will see maybe in 10, 15 years' time, when the algorithms are absolutely well trained and sensitive to these types of things. At the moment, they come to monitoring centres such as our own at Taking Care. And the reason for that is it gives us a chance to talk to the individual, to triage them, to make sure they're getting the right help and support, which means that if they need the emergency services, we will call on their behalf. The Apple Watch, which used to be able to notify 999 automatically, has actually had that feature turned off because there was concerns about people being referred accidentally. So we think it's really important that once that fall's detected, once the data has done its job, that's when human beings intervene to make sure you've got the right support there and then.
Yeah. Okay. So in the future, when this thing can measure, heart rate and oxygen levels and all that kind of stuff, and fire in data, it'll kind of replace a visiting nurse potentially.
So I think part of what you described is what the NHS would call a virtual ward, which is that there will come a time when people are discharged from hospital, they've got the right monitoring devices, and there will be a centre that will be monitoring a whole number of patients, and the data will tell the nurses these are the 4 or 5 that you really need to focus in on. So I actually don't believe at the end of the day it will replace that human to human intervention. I think what it will do, though, is to help prioritize those most at need. So the time of the nurse, the time of the doctor is spent with those people who really need it.
Yeah, no, that's good, because human interaction is vital for everyone. And if you're an old person living at home, you'd probably much rather a nurse come to visit rather than some machine taking your blood pressure and firing it into somewhere, goodness knows where.
No, you are absolutely right, and I don't think ever technology will replace the human intervention. Just to give you a really brief example, just to illustrate your point, when I went into our centre on Christmas Day, we have people who test their alarm on Christmas Day. And when I said to my team, why on earth would you want to test your alarm on Christmas Day? And they said, well, we are possibly the only people that they will talk to today. So that human to human interaction is absolutely vital. I think where technology helps us is to make sure that the time that those humans have, which we know is always under pressure in any health system, is used with those individuals who really, really need it.
Okay, no, that's good to know. What about other ways that AI can help with human interaction and the social side of things? Because I'm sure I've seen articles in newspapers and on social media and the like for robotic cats and dogs and that kind of thing that have been developed for old people's homes in Japan. I can see you smiling, but is that reality? Is that useful for anyone?
I think it is reality in Japan. However, I think to your point, and I think it's a really, really important point, the humanity of the connection that you get between two individuals, I don't think will ever be replaced by technology on its own. It can support it. It might be able to replace it in a small way. But when we did a survey a couple of months ago and asked about a whole range of technology solutions that might be helpful for the older person, the sort of robot type solutions came right down the bottom of the list. And very much those that came top of the list were about talking to other human beings, connecting with family, with friends as well. I think technology has got a huge part to play there. So I think robots can play a part, but I've got a sneaking suspicion for many, many years, it's going to be quite a minor part.
Yeah, in some ways I'm glad to hear that, because I'm just thinking the last time I used an AI chatbot on a website and how irritated I got trying to communicate with this thing.
Yeah. And there are some great examples again. Age UK run a number of what they call befriending services, where either people can phone up to have a conversation, or equally they put people together in a group with a common interest, and just say, look, here's a great chance to talk amongst yourselves. So a world away, as you say, from that sort of automated chatbot environment, but bringing that humanity.
Yeah, no, good. Glad to hear it. Well, I mean, social care is a massive issue, well, the world over probably, but certainly in the UK, bound up with NHS difficulties and all the rest of it. More and more people are looking after elderly relatives. So if someone is in that situation and they think, okay, some of this to help might be a good idea, I would like to find out a bit more about it. Steve, can you suggest some sources of good, genuine, useful information?
So three sources that I would absolutely recommend. First of all is the charity Age UK. They have a whole range of really, really important information sources, particularly around health and falls prevention. For the family, I would absolutely recommend Carers UK, again, a charity which is all about providing support to those family members who are caring, often informally, for mum or dad. And then our own website, taking.care, which has got a whole range of information about different technology solutions, including a little quiz you can answer, which again just helps you understand how likely you are to fall, and therefore how technology might be able to help you and prevent that fall. So I think there's a range of different information sources out there.
Yeah, good. All right. I think this is potentially very useful for a lot of people. So, Steve, thank you very much indeed for taking the time to chat.
Thank you, Mike.
Thank you very much to my guests on this week's show, and they were Dr. Hugh Cormican of Cerdan and Steve Gates of Taking Care. Of course, a big thank you to you for listening, and have a healthy week until next week.
Thanks for listening to the Relax Back UK show. Join me, Mike Dilk, again next week for more fascinating interviews and chat. If you're listening to the podcast version, please subscribe, like, and share it with your family and friends. And have a healthy week until next week.